and welcome to the Families, Health and Wellbeing Select Committee, and a warm welcome to those attending and to our viewers watching live on the Council's YouTube channel, Hillingdon, London. My name is Councillor Philip Corthorne, and I am Chairman of this meeting. Details of the business to be considered today are shown on the agenda, copies of which are accessible online under the live broadcast. For those present in the room and intending to speak, please note that you will be filmed and any statements you make will be recorded and made public. A reminder to anyone speaking today that your voice will only be audible online if the microphone is switched on. We are not expecting a fire drill, so if the alarm goes off, please follow officers to the fire exits and out of the building to the designated meeting point. As far as mobile and tablet devices are concerned, please switch off any mobile devices before the meeting starts or put them on silent. Please note that councillors on the committee may use their laptops or tablets during the meeting to view the agenda paperwork. And before we move on to the agenda, I'd like to introduce the councillors present at the meeting. Well, actually, one non-councillor committee member, Mr. Tony Riddle, to my left, Councillor Jan Sweeting for the Labour Group, Councillor Kerry Prince for the Labour Group, the Labour Lead, Councillor Ian Farner, Conservative Group Vice Chairman of the committee, Councillor Paula Rodriguez, Conservative Group Member, Councillor Judith Cooper, as is, and Councillor Becky Hagar, Conservative Group Member. So welcome all. Can I ask the officers present to introduce themselves, please, starting with yourself, Darren?
Good evening, I'm Darren Thorpe. I'm the Head of Business Delivery and Market Management across Social Care.
Hi, I'm Sarah Phillips. I'm the Project Manager managing School Place Planning and Capital.
Oh.
Good evening, I'm Dan Kennedy, Corporate Director for Planning, Environment, Education and Community Services.
Lovely, thank you very much indeed.
I'm Sharon Day, Consultant in Public Health and Deputy Director of Public Health.
Sharon, good to see you. Thank you. Right, so...
Initiative Democratic Services.
I do beg your pardon. I'm so sorry. I beg your pardon, as if I could forget you, Anisha. Keep me out of trouble. Okay, so coming to the agenda, so we've had apologies for absence to report the presence of any substitute members.
No apologies, Chairman.
Okay. Declaration of interest in matters coming before the meeting. None declared. To confirm that the items of business marked Part 1 would be considered in public and the items marked Part 2 would be considered in private. And with that, we come to our first agenda item, which was the minutes of the previous meeting, which I've managed to overlook, so I shall go back to those. I'm doing well so far this evening, aren't I? So the minutes of our meeting held on the 26th of October. Now, I really should be taking these for accuracy only. So can I move them at this point and make an additional point that we've had the information requested from Anisha on the 9th of November. I think, let me just make a general point. I think where there are points arising out of this that aren't later on in the agenda, we need to find a way of channeling those points in a way that's satisfactory. And if we can take that discussion offline, Councillor Prince, that's probably the best way to deal with it, if you're happy with that. All right? Thank you. So, okay. With that, if they're agreed, I can take it that they're agreed, we'll come to the Public Health Integrated Service Contracts. So, astute observers on the committee will be aware that I've been waiting for this report with some anticipation. I spoke about it in the life of the former POC, and I did make the point that in due course we will have this report, and it's an opportunity, I think, for us as a local authority really to shape the development of services in a way that's customer-focused, modern, and really serves people in the way they want to be served nowadays in terms of health provision. So it's a great opportunity. The contracts are being retendered, I think, next year, so we're moving towards that stage. So what we've got here, in essence, is a summary of the contracts that exist at the moment, how they're working. There's information on performance. There may be a question or two on that, but I'll wait for colleagues to pipe up on that. So really, with that, I'll hand over to Sharon. Very warm welcome to you, Sharon and Dan, to talk us through the report. Thank you. Have I stolen your thunder a bit? My apologies.
No, not at all. Thank you very much. So, having said that, what I think it's might be pertinent to say is that just so people understand is that we came over in 2013 with a suite of services from the NHS, because that's where public health used to sit, for those of you who aren't aware. And we came over with a set of mandated services and also non-mandated. So the mandated ones were integrated sexual and reproductive health, or rather sexual and reproductive health. There are two separate services. Weighing and measuring of children, NHS health checks, and Healthy Child Programme. I won't be talking about the Healthy Child Programme because that sits within another directorate. And then we also came up with non-specified mandated, which were integrated substance misuse, smoking cessation, and adult weight management. So the paper that you've got here talks about all of those services, the cost of them, and how they've actually developed over the years. And I'd just like to take in just very briefly to say that since the services came over, the very first thing that was said to me by the procurement team and also by the directorate I sat within was, we need to have a look at the services that have come. They can't remain the same. We want them to be tailored to meet the needs of the residents. And that, it was quite interesting because we always talked about patients and didn't think about the broader base of residents. That was quite an interesting perspective for us to get our heads around. So what we've done over the years with, for example, with sexual and reproductive health and also with substance misuse, taking them from being in separate contracts. So in substance misuse there are 5 different contracts. We've brought them all under one umbrella, under one contract, and modernised the service so it's more integrated, more in keeping with the needs of our residents and how their needs are met, making them more efficient and effective. But you cannot remain the same. Times have changed, so that contract was let in 2015. It's now time for a change. The world has moved on. We've had COVID. All sorts of things have happened, and even they themselves have adopted new ways of working. And as an example of, for example, substance misuse, they've actually developed what's called the Emerald Pathway, because I don't think many people realise that they always think of substance misuse as being opiate users or people who are alcoholics, but they always think of younger people. That pathway is specific for the over 50s in Hillingdon. They're almost like hidden addicts that we don't actually know a lot about. They've actually developed a service for them whereby they do in-reach into the home to actually meet the needs of those individuals, because when they look at Old Bank House, which is the headquarters of the substance misuse service, they think, but I don't look like that, my needs don't look like those people over there. So they've taken that into account and they do an in-reach into older people, often in their 70s or whatever, who may be drinking because they're lonely, they're widowed or whatever. So tailoring services to meet those particular needs. That's just one example, but there is more to be done. So as we move towards next year, more work will be done to see how we can modernise that service. The sexual health service, again, that was modernised in 2017. A lot of the service put online, and that actually put us in good stead for what happened last year with COVID, because we were easily able to adapt to moving from face-to-face into online provision. So that's just an example of what we've done. So I hope I've given you a flavour of the different services that we commission within the local authority for our residents. Nothing is set in stone, it's always moving, and the aim is to make sure that all the services that we commission do meet those needs. So we do mystery shopping, where we send out people, usually from Health Watch, who go out to look at services, and they feed back to us what they've found, and then we can able to tweak the service to meet those needs. But I think with some of the services like NHS health checks, it's not about even tweaking the service, it's probably about raising the profile of those services, because they've almost become wallpaper to our residents, and the uptake just isn't there. It was like that pre-COVID, but it's got worse since that time. So we want to relaunch that service as well to see whether we can get people thinking about it. The same goes for a very tiny service that we've got. It's only £1,000 a year for us, but it's actually funded by the government, and that's the Healthy Start programme. That programme has actually been in place since the 1940s, and who would think that you don't have high uptake of free fruit and vegetables and vitamins, but for some reason the uptake across the whole country is poor. So we want to change that around. So we've relaunched that, and we've already seen just within about the last 6 months that the uptake has increased to 60%. So with just a little bit more effort, we can actually get even maybe 90% of our residents, because they do need that with the challenges that they face financially. So that's to give you a flavour of what we're actually doing at the moment. I would welcome any questions.
Thank you very much. I'll begin Councillor Cooper, and I'll see who else is interested.
Thank you, Chairman, and thank you, Sharon. That's a really interesting report. There's a lot of things, there's a lot of information in the report. And I know because a lot of the work that Arch do is in my ward, and they're an excellent service. What I do take issue with is the baseline information about performance. So, for example, on page 14, you have a chart about health check performance. I can't see any pre-COVID data. So we've got 2013 to 2019, and there's no information. So I cannot work out a baseline for where your figures are coming from. And bearing that in mind, when I get down to what you're saying are cost pressures, and the aspirational target is 13.3% of the eligible population, I start to get a little bit worried. I do understand cost pressures, but 13.3% means an awful lot of people are not being reached. My real point is that there is a disparity between what is being said and the actual data that we can take out of this to see what progress is being made. Now, 13.3% might be very good if your starting point in 2018 was 2% or 3%, but we don't know what it is. So please, can we have the data clarified?
Right, so I think, can I give that to Anisha, because I think the manager who leads on this should be able to provide that service, but I think the current uptake is about 11%, but I don't want to say about, I'd rather give you the actual figure.
Well, the figure is in there. It's 10 point something. No, it's 9 point something, 9.6. My point is that I've nothing to judge that against.
Right.
I don't know whether you have improved from whether this was first introduced. I can't tell.
No,
I can't tell.
I can, to be honest, it has not improved. The figures have never really achieved what it should be achieving. The uptake has actually been much lower than we'd anticipated over the years, and that's the honest truth. So that's why we're trying to see whether we can actually improve that. It's become wallpaper. We need it to raise the profile of it and let people understand how important it is. But it's not just with residents, it's actually with the GPs themselves. They're extremely busy, so things like this area becomes more difficult and a challenge for them because they've got other issues that they want to deal with. We are talking to the practices now to say to them, can we have a look at different ways in which maybe we can actually commission this service, maybe through at a PCN level where they get assistance to supplement the work that they do, but at a primary care network level where there's another team that could be drawing people in. Because the main thing is not just about getting numbers of people through, it's about the preventive work that this actually will help with, reducing the number of coronary heart disease patients, reducing the number of strokes, people who have maybe alcohol dependence that's hidden. So this is what we're trying, and kidney disease. But there's a lot of work that does need to be done. But I think if we can represent these figures so they're more understandable to the committee, I would arrange for that to take place.
I would absolutely agree with you, but I would like to underline again that if we haven't got the data, it's very difficult for us to judge or make any kind of assessment of what is going on and what successes you're having. We do need to know that, please. Thank you, Chairman.
I will bring you in a second, Jan. Bear with me. I just want to endorse that. I mean, I think that's a perfectly fair observation. I mean, our role, obviously, is to play that critical friend, but we do need to see what's happening in relation to what we're supposed to be achieving. Now, I completely get that there may not be national performance indicators for all this stuff, but fair enough. If that's the case, say so. And if it's a question of benchmarking against comparative authorities, at least tell us that. So I think really that probably applies to a fair amount of what we've got here. So if I can perhaps extend that to these various contracts, it needn't be War and Peace, but it just gives us the bare bones of it really. So if I can echo the request that's been made, I dare say there are others that will do the same. But thank you for that. Councillor Sweeting.
Thank you, Chair. We're very reliant on accurate data, and I believe that a lot of the data that you rely on is from the Joint Strategic Needs Assessment report that the Council is involved in, as well as yourselves. How up to date is that, and how reliant is that? It would have been good to have seen sort of maps showing areas of deprivation in the borough to actually link the work that the various strands of work that you're doing is developing. Equity of provision is so important. And really, it would be, good to know whether we are using the most accurate data that we've got with the Joint Strategic Needs data, and whether we can see it much more simply in sort of map form, showing the areas where there is more work to be done in various areas of the borough to ensure equity of provision.
Right. So I think that they're two separate things. So a lot of the figures that you see here we get from the FOF, because I think I mentioned it quite a bit in here. It's a public health outcomes framework, and that is held by, it was called Public Health England, but it's now called OHID, Office of Health Improvement and Diversity, and they produce the comparative benchmarking data for us on all the areas that we're actually working on. And what they do it on a traffic light basis, so you can actually see how each service is performing based on that. They're based on a number of outcome indicators that they provide. In terms of the JSNA, we use that to inform the services, so we can actually say, okay, there's low uptake over there, what is it that's going on over there, how can we improve access? So for example, we've moved the centre of gravity for the provision of sexual and reproductive health from it was at THH, Hillingdon Hospital, down into Hayes, so there's just nearby to the Beck Theatre. That's where it is, because most of our cases are in the Hayes area. So we do use the JSNA, but it's more used to shape services as opposed to this. But it also gives you an indication about how well we are doing. You're right, so it links into what Councillor Cooper was saying. It will help you to understand how we improve the situation with these services.
Thank you. Could I have a follow-up? Oh, well, on top of page 11, it says this, and I don't know how you pronounce it, this PHOF, was last refreshed in 2019. So are we expecting a refresh very, very shortly?
We are. It should have been. There's usually one each quarter, but because of COVID, everybody in that team nationally, they were moved into working on the London coronavirus response cell. So a lot of the work that we would get from them is only now being refreshed. So yes, we anticipate. So we should be getting the next refresh. If not in December, it will definitely be in March.
Can I just have one third? Yes, it links to. I know. Thank you so much, Chair. Very good. Well, no, it's what Councillor Cooper was highlighting in the table 2, where we have compared to London boroughs. Now, many of our statistical information, we are compared to our statistical neighbours. Now, I don't know whether it would be very relevant in future to see that comparison, because it's all very well. I mean, we've not fared particularly well when we look at where we are with London boroughs, but particularly where we are with our statistical neighbours, because that's what we do in other areas of the council's work. Okay. Thank you.
Thank you. So just to be clear, I mean, there are 3 strands to that, but they're interlinked. So if we can just be clear on what's being asked for, then we can have that as soon as possible. Is that okay?
Yes.
Sharon? It's lovely. I mean, lovely, brilliant. Mr. Little, you've been very patient.
Thank you, Chairman. We've only been talking about performance up to now, but I wanted to ask more about the structure of these sorts of contracts. That in improvement in health, there's a large element of education involved, and also in providing people with correct incentives, either on the supply side, i.e. to provide the service, or on the demand side for those for whom the service is provided. And do we build that into the contracts? Have we particularly focused on those elements in the sorts of contracts that we do?
Do you mean in terms of how do we aim to meet the needs of residents?
Yes.
I think for all of them. So, for example, when we were doing the sexual health contract, we sent out a survey to ask people about how we were proposing to change the service. So when this was in 2016, we sent out a survey to say that we would like to move to more of a digital service. What do you feel about that? Because we were hearing in other countries and also in other parts of this country as well, that's what was going to happen. There'd be a digital platform, people get their tests online, they'd get the results back, etc. They could make appointments. And it came back 50-50. And what we found was that the younger population, that'd be brilliant. I don't really want to see anybody. I don't want to go to the GUM clinic or to the reproductive health clinic. I'd rather do it online. But then there are others saying, no, I would like to see a human being. So therefore, we structure the service in that way to to cater for the different needs. But having said that, we undertook it just before the COVID in March 2020. We did the mystery shopping with an older group of people, and they said, do you know that everything about sexual and reproductive health services is all about the young people? What about us? So we had to go back to the service to say to them, you need to start looking at even your messaging. It's very young. It was very young people focus. Some people actually had said to them when they went in, are you sure you need this service? And it made them feel awful that they were too old to go and use the service. So no, we do constantly looking at making and ensuring that our services meet the needs of residents.
Councillor, who have we got? Councillor McCartney next.
Thank you, Chairman. Thank you, Sharon. You mentioned the Emerald programme, and I was just interested to know that how do you identify who the in-reach patients or residents are?
So how they normally get them is that either through referral, self-referral, or through referral from the hospital. In the main, how it came about was they were noticing they were getting quite a few people being referred by the hospital because they've had fractures, and they suspected that they had been drinking at the time that they fell, and so it was. But the reason they'd gone under the radar is, and a lot of people actually knew, once they started talking to the GPs, etc., they actually suspected, but they found it was quite embarrassing to ask these individuals were they drinking. So rather than asking them, they were just sort of letting it lie, and therefore they were falling and having accidents either in the street or in the home. So it's not necessarily the sloppy slippers, poor lighting in the home, it's actually because they're drinking. So based on that, they started looking a bit more into it and spoke to the hospital, into the fractures, trauma and orthopaedics, to say, if you have anybody like this who is over 50, please let us know, because we can actually work with them. And that's what they did, and that's when they built the service around this client group. But now they're revisiting it, and they're now hoping to extend it. It has been problematic for them because it's in reach. They couldn't go into people's homes during COVID, and they're trying to entice them out because they did still need to be seen, but they didn't like coming to Old Bank House because they perceived it where drug misusers go, and I'm not like that. So now they're trying to say, how else can we actually meet these clients? Because they're not either digitally orientated either. So again, it's a difficulty. So the service is now in the process of seeing how can we make this more amenable to attracting people into the service.
Right, I've got Councillor Prince next.
Thank you. Like Councillor Corthorne, I find this stuff really interesting, but my knowledge isn't excellent on it. On page 20, under outcomes, and it's got the public health outcomes framework contains a number of specific indicators of sexual health. For example, syphilis diagnostic rate per hour of 100,000. What is the Hillingdon rate? How do we know how we fare in terms of these indicators?
Right, so for all of this, I didn't want to I could have made this document quite long. What I should have done with hindsight is I could actually put a spine in there, and you would see the reds, the greens and the oranges and how we're doing. So just off the top of my head, we're green on syphilis, we're red on gonorrhea, we're red on chlamydia, chlamydia detection, but we're, I think chlamydia proportion, where it's the reverse actually, it's red on chlamydia proportion, chlamydia detection, we're green. The new STIs, we are amber. HIV, late diagnosis, we're amber for those. We were in the red many years ago, but because of the new service, we've actually increased the identification, so we have fewer late diagnoses of HIV. That was a very tricky service when we were trying to transform that one, because there was a long existing service that had been in the borough, but it wasn't actually meeting the needs of the residents, only for a very small proportion. So we had to work gently with them to actually move the service into a bigger service which could actually offer a more appropriate service to meet the needs of all HIV sufferers, as opposed to one particular cohort of users. And under 25 repeat abortions, that's quite a sad one. We're red on that, and the fact that they're repeat abortions, something isn't quite working with that cohort of individuals. So we're now working with Councillor Palmer's particularly interested in this, to see whether we can get some more data on this. But it's very difficult because that service is actually not commissioned by us, but it's commissioned by the NHS. So we're trying to see whether we can get some more information about it. So what I will do for the next report is actually, or whoever comes with the next report, to put the spine in there so you can actually see what the performance is.
And hopefully what you've been talking about can be incorporated in what we're going to receive that we've already asked for.
Yes, for each,
if
for
that's
each
okay.
area we will put the spine in.
Yeah, okay, that's useful. Right, who have we got next? Councillor speaking, one more bite of the cherry, go on then.
You know it makes sense, Chairman.
Well,
Right. Take-up is low in various areas of this report, and so it's important that we do raise awareness. I mean, how can we do that as a council? How can we do that generally?
There's a communication plan that's being put in place, and that's going to be worked on in the new year. So again, we could provide some information about what that communication plan will look like. So the public health team, are working with our comms department, Emma Gilbertson, on that. So something more about the communications plan.
Yeah.
So it's the same thing that's happened with the Healthy Start. It's always been there. Again, like I call it wallpaper. People don't really know it's there. They're just ignoring it. But once you just start to raise the awareness amongst professionals, like people in the libraries and things like that, we've noticed that because they're able to make every contact count, so they're able to raise awareness, people coming into the service to talk to them about it. So comms.
Can I just say, is there an issue with GP capacity in respect of this?
Sorry, I missed that.
Is there an issue with GP capacity in respect of the health check?
It's not necessarily. It's not because I'm not in primary care, but I think COVID has actually caused problems. I think across the nation, it was actually Public Health England pressed the pause button on it because of COVID. So from last year until now, the pause button has been pressed, but gradually they're beginning to come back. But even prior to that, performance wasn't where we would like it to be.
Okay, I'm going to make a similar point in a minute, but there are other people. So I've still got Councillor Hagar. I've got another question from Councillor Prince, and I'm going to wind up at that point if there's nothing further. So let's come to Councillor Hagar first, please.
Yeah, thank you, Chair. I mean, it's a good report because you've got a lot in here, and you can recognise the challenges that you've had to face. Obviously, COVID has been a massive one. It's really put a stop to a lot of implementation of work that you were going to put through. A couple of things I just want to pick up. One was what Councillor Sweeten said, which is about communication, about how we can get that out across the board a bit bigger, a bit more alive, and just say, but I understand, again, we're stuck with funding and actually how much we can use, you know. But the other one was as well, I'd like to have seen a little bit more in here, and we have covered it with what Councillor Cooper said, a little bit of where we are with what we feel could be problem areas going forward. So in other words, if we feel that alcohol from the COVID is going to increase, and what are we going to do with that and how we're going to manage that. And also the defining on age group as well. You know, are we looking at more younger people taking to alcohol or not, or what? I'd like to have seen a little bit more depth in that, because I think that will really help us when we go forward for the future planning. And also under the drugs, one of the other things I think that we mentioned, I've been on this committee a long time, perhaps too long actually, but one of the things he did mention was about also medicated drugs, so being addicted to actually medicated drugs that have been given by the GPs and doctors. And I would like to see a little bit about that as well in here, and it's a big issue, or it can be a big issue, I know, and I wonder whether we have that in Hillingdon or not.
Yeah, we do.
Yeah, thank you.
Steroids and things like that.
Yeah, thanks. Oh, I just wanted just one more to say, I was really good to see the training that you picked up on that. The training was difficult, but you needed more trained staff, and it was good to see that you've had the training courses online and things like that. So I think that's really great.
Yeah, thank you.
Okay, and I've got Councillor Prince.
Thank you. Just one point and one question. My point is that it's really great to see that the Commission Substance Misuse Services talks about sex workers, a group often not included in these things and often highly stigmatised. So I think that's great that Hillingdon recognises them as a vulnerable group and one that needs targeted outreach. My question is on page 25, project title, Rough Sleeping, Drug and Alcohol Treatment Grant. It refers to, well, it uses the word will a lot, implying that it hasn't yet started. I'm wondering if that's just a mistake or if it hasn't started yet, and if not, why not?
I think it was an extract from the bid,
okay.
So it has started, and that's actually doing very well. The work they're doing very well. So that's something else that can actually be reported on for the next one. So what I'll try and do for the next one, and it won't be because I'll be leaving, but with the rest of the team I will inform them that. So this is just the lay of the land going forward. Because if it's going to be a regular report, it's going to come in. Let us see how they're progressing, so you can actually see where you were, how you're going, if it's a challenge, how can you overcome it.
Thank you very much. I'll save my questions till last. Couple really. What occurs to me about this, I mean, one of the reasons why I'm so excited about this juncture at which we've got an opportunity to really shape things moving forward is that I think, I would say this in local government, but I do think we're the most nimble part of the public sector, if you like, and there are some fantastic health service people out there, and I know many of them, but I do feel often they're hamstrung by NHS ways of working. So whilst we are certainly doing, I think we're heading in the right direction, we will ultimately still need to deliver all of this change through our health partners. I'm just wondering whether what you make of the development of integration and the partnerships that are going to be necessary to make this happen on the ground. So for all we're doing, important though it is going to come down to partnerships still. And when I look at the take-up of NHS health checks and some of the challenges around that and getting people weighed and what have you, and that is quite a challenge on the ground. So I'm not sure what's going to change of significance to make that easier. I just wonder what your thoughts are on that, if you wouldn't mind.
Yeah, I think going forward, the work that we're doing with Hillingdon Health and Care Partnership, and I know that because we're now in a new directorate, a very close working relationship with that. And I think for all the work that you've actually seen here, I think if we move towards a closer relationship, say for example around obesity, with our NHS partners, we can actually achieve even more. Because, for example, as you can see in obesity, there's different tiers. We provide tiers 1 and 2, but tiers 3 and 4 should be aligned with the NHS. So we're working with them to see whether we can encourage the provision of more tier 3, in particular, obesity work. Because that would actually make sense for the clients, the groups that we see. They can move on to those tiers if they need to. I think that's the work that we need to do to work more closely with them.
I'll give myself a quick supplementary on that, and that's around the Confederation of GPs. I understand they're involved now in the health checks. Could you just perhaps explain, for the benefit of those who don't know what the Confederation is, and perhaps what difference it's starting to make, what we're seeing, perhaps as a final question before I wind up?
I think the Confederation, that they represent the GPs in the area, and what they've done in certain areas within the NHS, they will provide services on the behalf of GPs as an entity. So, for example, for us, we approach them to say, would you be able to help us develop a pathway for adults who are overweight and obese? And the monies have been given to them, and they're able to draw on the client groups that are referred from various practices from across the borough, and able to give them tailored services to meet their particular needs. So rather than going to GPs individually, it's done at a higher level, and it's actually more successful working in that way. And we're commissioned, rather than commissioning with 45 different practices, it's one entity, but it's still providing services for residents. And they develop the pathway as well. They're very, very good. The Confederation actually developing pathways that meet the needs of residents.
Sure, thank you. Thank you for that, Sharon. Right, okay, well I think I'll wind up on this then. Let me say, no one else is indicating, so I shall proceed. In terms of the report, I mean, it's a good one. Noted what's been said about performance information, we must have that. But there's some good stuff in there, and some tremendous work that's going on with our people and our partners in our name, and we must never forget that. I think what would be useful would be a follow-up report in the spring, because by that time we'll hopefully have a lot more meat on the bone in terms of how this is starting to shape up with commissioning. So when we get to the forward plan part, I will suggest that. So I think that would be helpful. So thank you for that. I think the only other thing I would say is, Sharon, you've alluded to it already, but you're leaving the service of Hillingdon at the end of this month. And I'd like to thank you. I'm sure my colleagues will join me in thanking you for all your support and work in this borough over many years. And can I just say on a personal level, wearing some of the hats I've worn over the years, Cabinet Member of Health, Chair of the Health and Wellbeing Board, you've been a great support and source of advice. So thank you very much indeed, and we wish you well for the future.
Thank you very much, and I've enjoyed working with you too. Thank you.
Very good. Okay, so with that, can we agree the recommendation? Thank you very much indeed. Thank you. Feel free to stay, but don't feel you have to.
I'll be part if you don't mind.
Okay. Okay, take care. So, we then move on to agenda item 6, which is our quarterly update on school place planning. So, having heard from Sarah and Dan back in July, where does the time go? We're back again, so we look forward to receiving the update. I have been asked for some additional information from colleagues opposite, and I've shared that with you just for the to help support what you're going to present to us. I'm sure there'll be questions, but welcome back, and over to you, if that's okay.
Thank you, Chair. I'm afraid after Sharon, I feel that this is a much shorter report and not an omnibus provision, and I've referred to that in the report, that there's a lot of work underway, and a lot of it is now dependent on us getting the outcome of the October census from schools, which we still haven't got, which will answer some of the questions we've all got, and including those that have been put forward today. And also we're doing a lot of planning, but there is quite a lot in this report that shows how we're constantly adjusting the kind of strategic framework of the sort of 94 to 97 schools we've got, and not just the really big questions which are quite rare about are we going to have another building, another school, but the regular annual process of fine-tuning between those 90 odd schools and the 51 to 52,000 pupils across a very large borough, very big distances. Have we got the right match of the schools and the pupils to match? And so there's some fine-tuning which I'll come to in this report. And I can say it as fine-tuning, but I would say there is some sort of administrative and legal procedures involved in that. And also for those individual schools concerned, it's quite crucial and important to them, because it's about having the best fit of public resources to meet the local pupil need. So there is some stuff in this. I'm feeling defensive after Sharon's bravura display, you see. We will have a much bigger report in the spring, obviously, which will answer more of that. One of the things that's changed is that this year, after we had all the applications for Year 7 and reception almost made, and we were just about to start September and feel that all was well in the world, we started to get an unprecedented number of late applications. And those were from parents moving into the borough, a few who were already here, some of them had been EHE, for school places in every year group. And so at the end of August that seemed a bit odd, because it went over what normally happened. And then you think, well, some people have moved. And then into September it really did become quite heavy, and it continued all the way through October and is now sort of slowing up. But I'm talking about more than 100 applications in every year group in addition, so they're not the normal, they're what we call in-year applications. So it means that people are moving from one school, one part of London to another. Sometimes they're moving across the borough. Some of them are moving from far away places like Wales and Hull and Yorkshire like me. But so schools and the local admissions team have been dealing with that. Most of those will be captured on the October census, and that will give us a much bigger picture. But it does look as though, whereas we had a dip in roles over the last year, that there's been a bit of an upturn. We're not sure if it's now caught up yet with 2019 figures. And of course we don't know whether it's just a resettling after some people moved away or whatever, kept their children away from school, because it's much bigger in primary and in early years. Some people didn't start early years or even reception, so that's one of the bigger year groups affected. So we don't know if it's just a 1 year resettling, or is it the start of a new popularity of moving to Hillingdon, bearing in mind, of course, that there are over 7,000 new homes planned to be built by 25 across the borough, mainly across the middle and the south of the borough. I think a few are into Ruislip. I think it's on 31 different sites. So we are a growing borough, and we've got that planned in, but we weren't expecting quite this level of movement in a few months. And so that will all be something that we're still looking at, and it will come through in the October census across all the schools, and it will have different implications in different parts of the borough for different schools, no doubt, and we can have a much longer conversation in the spring on that one, because it has affected place planning and makes us think about, well, what if we had that level of in-year demand change every year? And one of the subjects that's been a big issue in this discussion and in the other committee beforehand about what is the appropriate margin to have. And I'm constantly working on that, and we'll have more answers on that in the spring. We've got a number of planning and feasibility projects underway where we're testing how we could change things. Maybe there might be more reductions next year in primary, but also that we'd still need to increase the numbers in secondary, maybe temporarily ahead of the planned permanent improvements and expansions that are planned, but also do some more expansions in SEN. I would like to draw the committee's attention to the fact that we've had a very successful expansion of one of the community special schools, Hedgewood, the primary one, where right after lockdown we went, because I obviously was aware that we did need to look at adding some better quality accommodation and also more places there to meet demand. And almost as soon as lockdown had finished, we had a big site meeting in sort of April, and by October half term we had 2 new buildings, 34 more places there, and real improvements to some of the functional therapy and toilet areas, which are so important to a school, a special school like that, and improvements to the playground. And that's something I think that all of us who've been involved, and it was just a pleasure to be a coordinator of that, with the council's own property team delivering. I've had to make clear, as they have, that we wouldn't normally be able to deliver so much within 6 months of a standing start, but we've got a load of interesting and challenging potential other special projects that I'm looking at, and some of them are quite innovative, quite interesting. Some of them reuse empty spaces in primary schools, some of them are looking at some other things, and we'll have more answers on that to bring in the spring as well. We've got most of the applications in. I think I mentioned, of course, the closing date for people to apply for year 7 places for next September was 31st of October, and we always knew that we'd have quite a lot, and we also know we've now got a few more that are late because they have joined the queue since then. So we're just looking at those, and we're waiting for some of the ones from people who apply from out of borough. And again, I can give you a full update on that in the spring about how we're going to work with secondary schools, as always, where we make some adjustments upwards in their operating PAN figure. You don't have to consult to increase the published admissions number, because the whole of the legal structure is based on the fact that you will meet parents' needs and you should increase. So therefore, if you want to reduce the published admissions number, you do need to check that you're not going to disadvantage any resident. So the published admissions number is the responsibility of the admissions authority. For community schools, it is the council. And therefore, because we're now, having discussed with individual schools, we're proposing 4 reductions in large schools of 30 places in each one to come down, and we'll keep the building if they ever need it, but it's just to match their sort of running costs with the number of pupils. So those 4, Field End Infant, Harefield Infant, Harefield Junior and Harlyn Primary School, where we're proposing reductions. Those proposals have to be proposed by the local authority. We've gone through it with the lead member for months, and I think I've mentioned it in here before. And then it's at the moment, those are all out to public consultation. At the moment, we've had very few comments. In fact, the only one that's critical at the moment that I've seen so far, because we look obviously on the website, was somebody saying, why didn't you do it earlier? But we don't do these until we're absolutely sure, is the answer to that. And of course, they are very large schools, and they will still be large. Even 60, 2-form entry is large by national and London standards. They were even larger because they had to go up when there were larger numbers in the past. Now, apart from the council being the admissions authority for community schools, we're blessed by having a range of foundation, voluntary aided schools and academy trusts in the borough. So we've got 39 other admissions bodies in the borough that we liaise with, and we've got 4 of them are also going to be consulting, and so they lead the consultation on reductions in PAN. Again, they're very large schools, reducing by 30, and officers are in agreement that those are sensible in the case, because most of them are operating at the level that they're suggesting at the moment, but it makes it easier for them to plan their staffing and not go into deficit or anything by that. So those are happening, and then there's a flurry of correspondence, because this is the picture across the whole of London and the South East, and we all have to consult neighbouring local authorities. So every day we get consulted from all the authorities across London and the South East on their proposed PAN reductions, because they all have to take place in this window of October to January, so that they can be published next year, so that parents applying for the year after know what the number is. So there's quite a lot flowing around. At the moment, there's none that we've seen from any other admissions body in other neighbouring authorities that would worry us, and they're quite minor changes. We've also got a consultation on a temporary closure of the nursery at Holy Trinity, which is being done by the governors because it's a Church of England school, so they're the admissions body. But that's because parental demand there has now fallen to an unviable level, and they will review demand and potentially reopen it in 2023. And there may be some consultations in shortly for a few minor changes in some special schools, because we get them in, and they would be 4-week consultations by the end of January, so we'll sort on that. And then the other thing, of course, is the wider issue that's known as school organisation, and about who's running the school and so on, and what is the school. So we've had 2 amalgamations of infant and junior schools, which is something that largely the world feels is a good thing, because there's more continuity for parents, for pupils, for the curriculum, for children with special needs where they want some continuity and maybe they don't fit into a year group, so it's sort of abrupt that whether they're in a year 2 or a year 3 and it's a different school. So Oak Farm Primary School has opened, and Lady Banks Primary School, so we've got 2 fewer community schools than we did have. And then, one of them, Oak Farm, was foundation schools, so we've got 1 fewer foundation school than we did have. Then we've got 2 schools that have joined Academy Trusts on the 1st of September. And that's the first time for a long time. Hermitage Primary School and Field End Junior School have both joined the Vanguard Academy Trust. And then in the spring, we have 2 new free schools. This is a weird thing because they're technically brand new schools and they're being built, and both on the site that they were already on. But legally, the old school closes, the new one is called a free school, and there are some changes to how they are funded in the short term. And that's Nanaksar, which has been operating in the past on the Guru Nanak Academy Trust campus, if you like. And now they've got, if you see it, it's quite a big building because it's going to be 4 forms of entry primary school opening. And at the moment they've only got quite a small number in reception, and that will build up. And then the Young People's Academy has been rebuilt, and I was lucky enough to go on a tour of it. It wasn't finished when I went, but you could just feel that it's just going to be such a different experience. It's going to have proper therapy rooms, it's got really good sized classrooms, small group rooms. It is absolutely going to be a different experience for some of our most needy children, and we've got more places there, so that's pretty good. I can give you a full update on all the 13 funded and managed the ones that are funded and managed by the DFE. I'll give you an update because I'm getting one off the DFE for each project and have that by January. It was 12, and just to update you, in case I hadn't mentioned it before, that the DFE decided to upgrade and rebuild most of Rosedale School as one of their, what they call their SRP, which they mean School Rebuilding Programme, of the worst 500 schools in the country. So they said that Rosedale is one of the worst buildings, partly because some of the building has very inadequate sized classrooms. And it's going to be quite critical as well for place planning, because at the moment Rosedale School is not completely full, and it will be brilliant for that school. It may still be rebuilt as 6FE, which is what it is, but at the moment it's not full, and so it'll be brilliant to have another school in the south of the borough that's a good quality building and will really meet all the needs of residents. And I thought it might be helpful for you to see this chart of all the different types of school to refer to in future, because it is a bit weird about how many different kinds of school we've got, and at different times, particularly for school place planning, it becomes relevant. And of course it does become relevant for some other services of the council, because there are different legal powers for each group. And every now and again I try and work on something called the School Organisation Plan, which would be an easy compendium. So I'm giving you it in bits. I gave you that free map last time, and this one, and there'll be some more of it for you in January. Thanks.
Thank you very much, Sarah. You mentioned feeling defensive to begin with. No reason for you to do that. I mean, let me just say that whatever questions you will get asked, and you certainly will get asked some, it's our job to ask searching questions. Never lose sight of the fact that there's an underlying recognition that the first-class job the officer team do in this extremely challenging and unpredictable area of service. So don't forget that, but I'm sure my colleagues will associate myself with that, and hopefully the colleagues opposite would do as well. So let me just make that point before we start. And I've got Councillor McCartney indicating, so I'll take you first, if I may.
Yeah, thank you, Chairman. Thank you, Sarah. You mentioned that in August of this year there was unprecedented number of new applications. My question is around how this has impacted our SEND provision and the pressures within SEND and also children with educational healthcare plans.
Yes, it's true that some of the pupils do have SEND, and we've established procedures for very quickly assessing that as far as we can. It's also true that some of them didn't always reveal it, so some of them did start in mainstream primary and secondary schools, and then we've had to do the assessments. So yes, some of them have needed more assessment and may need and are adding to the demand for SEND places, but it's not a huge number, I believe, but maybe I can get you those kind of figures by January.
Yes, thank you. If that's okay, can we have the figures on that then, please? Thank you.
Okay, so I'm going to call Councillor Sweeting next.
Thank you, Chair. We've been having these reports since 2014, the school planning, and each one has been quite different. Sometimes there's been projections, sometimes there's been actual numbers in classrooms by area. And this report, and I realise that you're in a sort of, you haven't got the information ready to give us really details, but it would be good in future, I would suggest, that we have the report that covers all three areas of place planning: primary, secondary, special. And in this report, we've got nothing really about special, although we know that that's a really big issue that's looming over us as a council, and that there's going to be an absolute reset. And I think that's the phrase that was used at Schools Forum, an absolute reset in respect of that. But we've got very little about the secondary places. And we know that we've got a looming Year 6, and that the capacity in Year 7 is not really matching Year 6. And it would be really good, I think, that the report actually provided information on that, even if it is old information, i.e. information coming from the last census that's been verified, so that we have some inkling of the problem that might be coming our way, especially when we are having these in-term admissions. And I come back to the Department for Education's recommendation that there should be at least 5%, and I call it wriggle room, so that we have not got children being offered places in Harefield that live in West Drayton, which has been the secondary an issue with a family that I've been dealing with. So are we working towards at least 5% of unfilled places in our secondaries? Because in the past it's only been sort of 2%, especially in the light of this new applications coming in. And can we sort of have the information on where we are with Year 7 capacity and Year 6 numbers, so at least we can see that looming problem before it hits us?
Okay, can we over to you, Dan, or Sarah, as appropriate?
Thank you. If I could pick up some of those points, Councillor Sweeting, thank you. So certainly, yes, we can include those three sections, primary, secondary and special, in the report. What we tend to try to do is focus on the sort of where we're at in the cycle of forecasting. So if I jump to secondary places, I know that was a particular area of interest. We're just to explain it, the application deadline for secondary applications was the 31st of October. So we're just 1 month on from having that data set, so it's not sort of settled yet. And then I know you know this, Councillor Sweeting, but when we go through that process of iteration where we work towards National Offer Day in March for secondary school places, and the reason I'm making that particular point is that there's quite a number of stages to go through before we actually get to a settled position. So We have to share information with other boroughs. There will be children who would have applied to schools, places in this borough, outside borough. So there's a lot of, the very early numbers we get are not the true position, so we've got to wait for it to settle. That said, we are crunching the numbers. We've got an indicative position at this point in time, so it's a little too early just to release that. And we will, of course, be briefing the cabinet member and the cabinet on what that looks like. We are looking at what the demand is that's presenting, including some sort of provision for the unexpected demand that Sarah mentioned with in-year applications at the start of this school year. So in other words, it's a little too early to say, and what we didn't want to do is to put in figures that would perhaps mislead the committee, but please be reassured that we're actually working through a process at the moment. We haven't even got the October census figures available and verified as yet, but we will of course make them available to the committee as soon as they're available.
Thank you. Do you have a supplementary, Jan?
Yes, please. Yes, but you've done your projections. Your projections should be able to see in the past this cohort survival projection, how close you've been, and that must give you some indication of where we would be. I mean, I'm surprised as well that we know that we've got a possible problem, that we're approaching some of our secondaries to have bulge classes, and it will be interesting to know how many of those are being approached. And also, it's interesting, and some clarification on why one of our secondaries is having their PAN reduced. Where does that fit in, please?
Have you got those, Dan?
So yes, certainly we've got the forecast information, and that can certainly be made available to the committee. In terms of sort of conversion rate from year 6 to year 7, typically that would be somewhere in the order of 96 to 97%. But it can vary from one year to the next, particularly with applications which are made outside the borough and parental choice to some selective schools. In terms of the position around the change in published admission number, in this case Oakwood, I mean that's done for a whole number of different reasons. But if we need those extra places, they can be mobilised. So they're still available. They're still in the system. The building space is still there, and so that was the discussion we've had with head teacher and his senior leadership team, and that's the position in place.
Thank you. I had two questions. One was on the Oakwood one. Is this a matter of the financial management of the school? And my second question relates to the primaries, where we're undertaking a number of reductions in admission numbers. Other schools are taking a number of reductions in admission numbers. Are we confident about the cumulative effect?
Sarah?
Okay, thanks. I'm confident of the cumulative effect, and we've looked at each one in the context of the overall picture. As you know, our primary surplus rate across the borough was going up to about, and I'd reported it last time, it was going up to about 15-16%. And we had some individual schools, including some of these, where they were more like 30% surplus places. And that's really the issue, is acknowledging after a while that we need to actually confirm that those places at the moment are being mothballed, and we don't want them recruiting staff and heating them all and so on. And in a sense that's the issue at Oakwood. Oakwood is our second largest secondary school, so we've got one secondary school that's larger with a PAN of 300, that's 10 FE, and Oakwood is built to be 270, that's 9 forms of entry. And it's actually never quite filled at 9 forms of entry. And yes, many colleagues will know that, yes, there is a deficit, which is being borne by the council at the moment, and we're working very positively, and the school is working marvellously at being as efficient as possible. And looking at it, we realised that actually the number that they're getting is always really 30 short. And for the moment, we should put this pan reduction in, which wouldn't take effect till 2023. And it may be that parents will apply in greater numbers, and we won't need, at that point, the school's absolutely sure. If there are enough parents, they would then agree to go up to their full 270. But it makes no sense for the school to be staffed at 270, which is actually fueling a deficit. And it's a more efficient way of working. So that's that situation. I don't like talking about individual schools too much, but some of that's in the public domain, and to clarify, it's sensible.
Thank you. I'll come in with a couple of questions of my own then. I wonder what we're able to say in the light of what we're hearing about the increase, the unprecedented increase we're talking about the need for another secondary school in the north of the borough, because I've raised this question last time. What does that change the dynamics of the situation, or do we not know? And just generally, when we're talking about reductions to pupil admission numbers in individual schools, I mean, presumably due process requires us to work very closely with schools, and what's coming forward is very much in partnership and with their support, perhaps the wrong word maybe, but they're actually working with us and they're on board with what's being proposed. Would that be fair to say?
Oh, absolutely. And lots of the schools have delayed for a while thinking about this. But as you've seen, they're some of the schools. In fact, it's the school with the second largest secondary PAN, and then one of them is the school with the largest primary PAN of 150, going down to 120. It's not a shock horror situation at all. It'll still be the largest school in the borough. It'll still got more pupils than 3 of our secondary schools, and many others. So it's. They go up, they go down. That's what happens when you've got 52,000 pupils. And they went up to these larger numbers about 10 years ago. We're adjusting them down. We've got a good school situation with the margins still above those that Councillor Sweeting was mentioning, still above 5% in primary. And we're aiming to get to that situation with secondary. And Dan?
In respect to the new school, that reflects pretty much the conversation we had earlier about the secondary places forecast. Will be clearer once we've crunched the numbers from the applications for September, October for next September, and then we'll be advising the cabinet in the next month or so.
I'll just add that the crucial thing, which is probably indicating that we do need the new secondary school, as we thought for many years, is about how much bigger those numbers in the year groups in primary are. Because we know that we've always known that the secondary, I've reported it to this committee, the secondary schools know that we knew that we would have a few years. So was it that we would just have a couple of years of bulge in secondary, we didn't need to open another school? And that's why it's very crucial for us to see the October rolls, because actually even a few hundred, we don't know exactly how many people have left the primary schools. We'll see that when we get the October census. But if we've got a growth in primary roles in every year group that exist, these are children that exist in our primary schools, it was one thing for us to say, well, we'll be cautious and maybe should we think about just having bulge classes in our existing secondary schools, filling every space and every cranny and having a few more, and then the numbers are going to go down. But actually, if we look, and I'm sure that many members of this committee will be really looking when I present that in the spring, it may be very clear that we're not just talking about a bulge of a couple of years.
Okay, one further question from Councillor Sweeting.
I'm particularly interested in the special school capacity, because I know there's lots of discussions going on in respect of the safety valve agreement that the council will need to be put in place. And so is it possible that we do have a detailed report on special school places in respect of our next report? Because I think it has been acknowledged that there's been some tardiness in the planning of our special school places, and that we do need to be certain that we're on the ball in respect of that.
Yes, I'm working closely with our SEND colleagues who are leading the discussions on the safety valve. We're looking at options for that, and subject to member approval and everything to do with the safety valve, which I'm imagining will be public by January, we'll be able to give you a detailed picture of what we're planning. It should be firmed up by then, because you're right, it's likely there will be some more expansion of special schools, and we're looking at options quite actively.
Thank you.
Can I just have one more question?
One more question,
It's
Councillor
just
Sweeting.
to clarify the one other school that might well be reducing its PAN, and that's Hillside Infants. Now, it's my understanding that that building was only completed in 2019 at a cost of £8 million. Are we really now saying that the capacity of that building, of those two buildings, Hillside Infants, I don't believe the junior has ever gone up to its 90 PAN. So what's the reason why we are in that position in respect of that school?
Well, I mean, basically that people have moved away from that area. It does seem that some of the Hillside is right at the top of the borough. I'm disappointed you haven't all brought the maps I gave you last time. But there you go. Sorry, maybe one of you has done. But some of the pupils that were filling it and were driving the demand lived near Hillside, but actually lived south of Watford, and some of those were European and went after Brexit. So the north east of the borough is one of the few areas of the borough that I'm aware of that was affected by Brexit, that the schools did have some. So whereas Hillside had increased its numbers and they were getting year groups that were at 90, or certainly above 60, so they needed the expansion for several years. At the moment, it's not quite in that situation there. So again, it's a sensible thing to reduce the operating figure for MAL.
I mean, just to add to that, I mean, I think that illustrates the point very well. Is that naturally and I'm stating the obvious, I realise, but our populations are fluid. They're constantly evolving and changing and moving, and therefore, we need to be flexible and with also the education estate, the school places we have, so that we don't have that situation where we're funding school places or or schools are experiencing budget pressures unnecessarily. So I think it's just it's about sort of keeping up with the flow really in terms of where the population is.
Thank you very much indeed. Okay, well let me just sort of come to a conclusion on this. So thank you very much for the update. I mean, certainly the request for the additional information in terms of how this is reported in future would be very welcome, I think, just to give us the complete picture. So that's a point well made. Obviously, this is now shaping up to be quite a meaty discussion in January, of course, when we'll be looking at the report that's going to Cabinet, and we'll have an opportunity to comment on that in terms of the PAN reductions that are proposed. So I look forward to that. And obviously, we'll have the October information, which we don't currently have sight of, so it should be interesting to see how that all shapes up. So thank you very much for that. And with that, I will move the recommendation. Is that agreed? Thank you very much indeed. Okay, so we'll move rapidly on to the major review. Right. Yeah, I know.
Okay.
Thank you. Yes, I'm better where it's Darren's report, Darren, but I'm just going to give a brief sort of bit of context before you come in, if that's all right, Darren. So obviously this takes me back now to my very first POC that I chaired back in January. We were at this corresponding stage of the autism review, and it was our task to sort of weave out the various strands, components that we wanted officers to go away, look at, road test, and to develop into recommendations we could then consider for Cabinet. And this is the stage we're at this evening. So what we've got before us are two reports. We've got the main report, Agenda Item 8. We've had a supplementary paper, Agenda Item 7, which includes, among other things, the results of the survey of service users, which is good to have. I'm going to ask Darren to introduce those reports fairly briefly. Darren, if you can kind of give us a sense of where we are and a general roundup up to date. But I think once we've done that, what I propose to do is to discuss a way forward. What I shared ahead of the meeting are some ideas, and they're really only ideas, frankly, for us to think about in that context, and we can play around with that all we like, but you've got something to start with anyway. Anyway, enough of that. Darren, over to you, please, if you would. Thank you.
Thank you, Chairman. Just draw the committee's attention to the supplementary report before coming on to the main item listed under Agenda Item 8. As mentioned previously at other meetings, as part of this review, we did conduct a survey of current service users across all ages, not just older adults. And as part of the supplementary report, I've got some highlights of the response to that survey. The full responses are included as part of the appendix. Also in the supplementary report, there's further details of some of the case studies that have been referred to in some of the previous witness sessions, and also links to other reviews and projects which are ongoing at the time, again, which have been mentioned previously, just as the wider digitisation project. So, taking just through the highlights of the survey, we did get 101 responses, which again gives us a flavour and a cross-section of service users. When we look at the questions that we posed, highlights regarding satisfaction levels, high satisfaction level, around 98%, giving positive answers ranging from they didn't mind using it to they like using it to actually they love using it. 2% responding in a negative fashion of either not liking it or said they didn't use it. When questioned further on why they didn't like it or didn't use it, I'll just give you a flavour for the type of responses. Either didn't like wearing either the wristband or the pendant or the item of equipment that they had. They forget to use it, and again, that's something that came up earlier today. Another interesting one is it makes them feel old or vulnerable. And another highlight of that response was the trust in technology. So, although it's good to focus on the positive, high satisfaction levels, perhaps the tougher nut to crack is how we then respond and find solutions for those that stated that even though they had the equipment, they didn't actually like using or didn't use it. Another section of the survey asked the type of equipment that they would like to use, and again, rather than you'll see in the appendix, some have been referred to by product names, whether that be the Portal or Alexa, but actually, if you look at the themes that they're trying to get across, so they're either linked to communication. They want equipment so that they can communicate and feel less isolated. So again, the camera, the Portal, the Alexa, having the ability to stay in touch with carers or loved ones. And other sort of definitions would be around helping them feel secure, so such as the health monitors and the full sensors. So again, although they have listed some products by name, I think it's more the theme of what it is they're trying to addressed through that. So examples, GPS watches and the Ring doorbell. The Ring doorbell, prime example of someone about to feel more secure, and use of the full sensor and the talker, again a way of making sure that they feel that if they were to fall, that someone would be alerted, so that that feeling of safe in their own home. And then the ability to communicate, so whether it be through Alexa or Echo or the Facebook portal, then again it just addresses that isolation issue. Interestingly enough, around 2/3 of the responders had a mobile phone or had access to mobile phone, and again, as we've picked up through other witness sessions through this review, the technology being developed does so at a pace, so any ability where apps can then be produced and be downloaded downloaded onto mobile phones, that will then show we'll be able to access or make it available to more of our service users and residents. The case studies looked at, I mentioned in previous sessions, some of those have been summarised in the report, and others we've provided the link to the further case study. They're from a range of other local authorities and from the NHS. The NHS is a prime example of where some of this technology was developed initially and is now being diversified into other uses. So that there's quite a few case studies from the NHS about the use of technology, and it's interesting to see how we can then transfer that knowledge into social care. We then, this short section just highlighted there about compliments of the Telecare line, and an example of someone that's provided positive feedback after their use of it. Again, Telecare was an example, just coming on to into the next report of how we've demonstrated the services that are currently available, and some feedback from Hillingdon's own social workers working out of the residential care homes, and showing how the technology is being used there, such as the alert regarding a service user with epileptic seizure, and the mattress sensors, which then alert staff if residents get out of bed or perhaps require support during the evening. Okay. Made reference to other areas of council projects which are linked to the assisted living technology review. Again, I've made previous mention to digitisation and the wider digitisation agenda. That project is just coming to the end of phase 1, which was basically its scoping phase and looking at infrastructure and connectivity. Phase 2 is currently being drafted now, the scope for that, and I've had conversations with the project lead for digitisation, and that will include connectivity issues specifically around social care services and assisted living technology. Just to give an overview of the digitisation agenda, with regards to the transfer and the digital switchover in 2025, the Council's conducting a review to see how that impacts on a range of council services, so not just social care, and how we can then ensure that there's digital delivery as far as possible for a range of of council services. Specifically linked to that, again, we've seen examples of the Telecare equipment in use when we had the visit to Parkview Courts, but to ensure that that technology is digital compatible, there is a project underway at the moment where each type of equipment which is implemented through Telecare is being checked for its digital compatibility. And again, at the last session, when we heard from some of the technology providers, they gave some assurances regarding preparation so that equipment could be converted and would still be able to communicate through the digital system, and that is something that actually we've borne out through our own testing, and we've found that most of the equipment that we've tested so far is compatible with digital lines. However, rather than going through the analog phone socket, it just requires a further connection into an internet router. So that project is ongoing, and as we say, there's over 6,000 residents that benefit from Telecare, and obviously it's focusing mainly on the older equipment. As we know, the equipment that's been issued more recently is digital compatible. With regards to next steps, as part of the review, obviously we've been taking on board the information provided through service users, care providers, technology providers, and relatives and carers, and considering how we can move this forward alongside the wider digitisation agenda. I hope that the committee would agree that from the discussions that we've had with service users and support organisations, that the fear that residents would be hesitant and slightly apprehensive of the use of technology, it isn't as great as we thought. That most are embracing the use of technology. I think as it becomes more embedded in our daily lives, then we need to ensure that we're offering that choice. As we look at the how we build it into social care and health services in particular, as demand increases, the use of technology to provide a more efficient and effective service, whilst being mindful of not completely replacing face-to-face human interaction, is something that warrants further consideration, not only from the as stated in the paper, demand management and resource management, but also ensuring that we're meeting the needs of residents. And as more and more residents get used to the use of technology in their everyday lives, and they just expect service delivery and the model, a delivery model to change and reflect the way that they actually want to access services. So that's something that we will be mindful of. Again, the technology that perhaps we've been most used to over the years regarding the traditional button and box and pull cords of the early Telecare lines service delivery. Obviously, we've demonstrated so far how that is moving along at pace, and particularly as the younger generation moves up through, and the fact that they're used to technological solutions to their everyday lives, and obviously we need to make sure that our Telecare and social care services in general match pace with that. So in view of that, and particularly in view of the information that's been gleaned through the review, we'll be looking to develop a strategy, and I've noted some of the themes for future consideration by the committee. It's anticipated that we'll have the assisted living or technology support strategy for assisted living to be developed by the end of March 2022, and how that will be intrinsically linked with the wider digitisation agenda, because obviously we've been mindful of the infrastructure and connectivity issues that we've already highlighted, and most of this equipment as we move forward will have Wi-Fi compatibility, so we need to make sure that residents in all areas of the borough have equal access to that technology. Also looking at, as part of the strategy, will be a universal offer as well as a targeted social care offer. Again, this is similar to the current Telecare offer, where there are certain levels of service which residents can access, and again taking on board comments from the committee previously to ensure that we look at all ages, and develop a strategy which takes into account the needs and demands of our younger residents all the way through to the older population. So again, there is currently fees and charges associated with Telecare, and we will continue to review that to ensure that they're fair and equitable, and taking on board again some of the comments that we've had earlier in the review and through the results of the survey. It's ensuring that the strategy includes a communication strategy for ensuring that residents aren't fearful of the technology and are aware of the training and support that's available on the use of the technology, and not necessarily directly just for the end service user, but sometimes more importantly for their relatives, so that they feel an element of comfort that their loved one is still being cared for. And again, building on the virtual reality session we had previously, looking at training sessions for social care staff to ensure that they can make full use of the technology that's available. Okay. Again, the strategy will look to build and create a catalogue of equipment, so that as part of the initial assessment, when a resident comes through the social care front door, then social workers are fully aware of the options that are available and can best match the equipment to the needs of the service user, and ensure that there's a plan on the use of technology as part of that overall support package. And finally, that again, as we've taken on with questions with the technology providers, the issue with technology is to ensure that we're always matching the curve, because we don't want to get left behind. So we'll be looking to develop a strategy which looks at a 3 to 5 year period, so that we can develop the service offer in line with changes in the products that are available.
Darren, thank you for that summary. Thank you very much indeed. I'm going to suggest a way ahead in terms of the things we might want to think about. But before I do that, are there any questions for Darren at all? Councillor Prince?
Thank you. Reading the survey questionnaire thing, it has made me thought, perhaps just for future knowledge, that this would have been very helpful to have had at the start of the review, nearer the start, to help inform the questions that we asked witnesses. Appreciate it's just how things have happened, but just should you redo this exercise in some years' time, because it's very interesting. I've got a few points on this. Is 101 responses good, do you think, in terms of responses to other things that we've done? It's hard to measure whether that's a successful response. I've carried out surveys for things through work, and I think 101 is good. Getting 101 people to respond is good, but it's just interesting whether we've got any comparison for that. I am disappointed by the lack of young person response, well, under 40 response really. So I wonder, how did we advertise this? I can't see it in the report, it might be in there. And how long was it live for? I'm interested in the methodology behind the questionnaire.
Okay, thank you. Well, to take the point that the responders themselves may have been not through under 40, but the end service user may well have been, because we sent the survey out to all families that through the direct payment system, so we know we had that their children had a social care need. So the responder, when checking that box, could have been the parent or carer. That was something that we looked at. With regards to the number of responses, 101 I thought was quite a good response. I'd have to look back to see if we've done previous Telecare surveys to see if that's comparable, but I think also the fact that we did send it to a range of social care service users, and not just those that are in direct receipt of Telecare at the moment. So we were able to balance off between those that probably had a wish list and those that we knew were directly accessing services through Telecare. And as for the timeline of the survey, I can get that information and send that to Anisha.
Thank you, Darren. And Councillor Haggard.
Yes, thank you. I too, like Councillor Prince, actually I found that survey incredibly interesting, and it brought up it's really good, and it brought up an awful lot of things like, do we use the computer or not? And actually a lot of them don't, and that would be my worry, I think, when looking at information that we're bringing in. I think another point that's come up for me as well in this, as we've done that with the client, is actually the carer and the client needs are going to be different. And I think that's something we need to maybe look at that we haven't, and I've only just really seen that. So in other words, the client might not really be using it, but the carer might be using it more, which is just what you've said. And the other thing I noticed as well, that Alexia is great. They seem to like that. That's been one of the things on here, wasn't it? And that's all voice recognition rather than touch. So again, I'm steering away from the pad and going on to the voice recognition thing. So that was just 2 points that I wanted to make there that maybe hadn't come up before. But thank you so much for the survey. I think a carer's survey might be good too. I don't know, but thank you.
Another piece of work, Councillor Haggard. Quick question for me, Darren. Just on the survey then, I'm interested in what we said to the people taking part about what they were doing and why they were doing it. They were aware that we were looking at perhaps developing the Telecare offer, the assisted living technology offer, or did we not say that? Or did it just be helpful to understand how it was put to them? It might perhaps have had a bearing on some of the answers, that's all.
I think when you're doing surveys of this type, we also have to be mindful of not raising expectations, and then people think that we're going to be able to deliver things that we're never going to be able to deliver. So it was just issued as a general survey. There was no mention of a review of services beyond them as service users.
Okay, fair enough. If there are no more questions, there is another question. Councillor Prince?
It's just more of a point. It's good to see that there's quite a good geographical spread. It seems so by the pie chart anyway, which is great. And also I assume the orange segment on question 25 is white, because I don't think it's actually got a label at all. Yeah, I'm having to use it on my phone to see what was colour. It's just should this go any further? Maybe just worth adding that in, because it doesn't. Yeah, you've got it in colour. Yeah.
Okay. Mine's not in colour either, but fair enough. Okay. Well, just to sort of conclude the discussion a bit. I suppose. I mean, this is my first experience of a full end-to-end major review. Other people on the committee may have more experience with them than I do. I think what I've come to realise is that they're not always very neat and tidy. You may have very clear scoping arrangements that you agree to begin with, but it doesn't always happen like that. I mean, a disappointment for me has been the fact that Bristol University have not had any current live research that we could have usefully tapped into as part of this. Although when I come on to talk about that in a minute, hopefully that's not something that we can discount for the future, and hopefully we can pick it up. And I think sometimes you just take opportunities where they're there, and there's stuff we've got we might not have anticipated, and perhaps other things we haven't got. But I think it's in the nature of these things really. So I would like to record my thanks to colleagues for their participation and making themselves available out of hours, as it were, to be involved in various witness sessions. Okay, so really just to move this forward, bear in mind what I said about what this discussion is about. These are themes now that we're looking for officers to take away, work up, road test, cost, whatever else, because subject to the usual rules, of course, and to come back and present as draft recommendation at the next meeting. That's what this is. Now, I have previously circulated some ideas, but I will, for the benefit of the watching public, briefly run through these and just open up for the discussion and see where it takes us, so that's okay. So the first one is that the outputs of the contributions from service users, families, carers, health and voluntary sector partners, care providers, manufacturers and local authorities are reflected in the forthcoming assisted living technology strategy as part of the wider digitisation programme. And this will cover the major entry point that residents have with council, whether that be universal services or social care. When I say universal services, I'm talking about health as well, domestic abuse service users, for example, the whole remit really. I think there's a lot of opportunities there that we can pick up and harness. That's the first thing I would suggest we consider putting forward to officers. I then think a checklist. I think developing a checklist to support the social care assessment process to ensure that the potential of current and prospective future ALT offer is fully harnessed as part of any support package. And that's something that I think is a real opportunity for us. And I think that's with a view to stressing these are not necessarily to replace human contact. It's there very much to augment the totality of our offer and its capacity to support independent living. And I'd put into that people with long-term health conditions as well, because I think there's capacity too. Maybe similar to the Hillingdon for All patient activation measure, which I've mentioned at previous meetings, and this is really where they assess and gauge capacity of individuals to use technology and whether they can be helped to some extent. So that's my second point. The third one is really to develop a narrative to tackle some of the myths about assisted living technology and engender confidence in its usage on the part of service users and families. I don't wholly agree with you, Darren, on your observation about there's perhaps not that much resistance. I think there possibly is, and I think we do need to build that confidence, and I think whatever we can do, whatever we can do to build that as part of this, I think is going to be a critical part of moving forward. Okay, three more you'd be pleased to hear. I suggest also that we work to ensure that providers take a consistent approach in moving all their systems online to improve the effectiveness of service monitoring and delivery in sync with health and social care partners. We heard that from Comfort Care, I think, at Parkview, and it struck me as being something that actually we may not be able to force them to do it. We can certainly get them to work towards it, I would have thought. So that's one there, and I would think we could usefully look at. Two more. I think we had the headset session, and the suggestion is that we conduct a training needs analysis to support the rollout of headset training and other appropriate training interventions to gain the maximum benefit from what it is we're doing and making sure our people and partners are properly equipped to do that. And the last point I want to suggest is that we continue to liaise with Brunel University and other sources of research and development and good practice to ensure the ongoing evolution of ALT strategy continues to be informed by good practice. And I think, to be honest, as I see it, this is the start of a journey, really. We've done a lot of groundwork, hopefully, to support things moving forward, but things do change, and we just really need to be cited on that. Okay, I've spoken enough. I'm going to open up now to comments and questions. Councillor Prince first.
Thank you. I agree with everything you said, which is...
Goodness, right, okay.
What did you say? Did you not call me? No. Oh, never mind.
I did call you. Carry on.
Oh, right. Okay. Then why are people laughing?
No, I was mildly amused when you said you agreed with everything I said. That was all.
Oh, right.
Hesitating there.
Oh, it shocked me as well. Shall I carry on? Okay, yes, I did agree with what you said, which, yes, is a surprise. I wonder if there's also an opportunity to have something along the lines of continuing to listen to service users, not just as a one-off when we conduct these reviews, but as a perhaps an informal way that we can keep consulting with service users and not just feeding in once every 3 to 5 years. Something like that.
Let me say that again. I don't think there's such thing as a bad idea in that sense. Officers are working up these ideas. Have you got any comments on that, Darren?
So, again, and obviously, we do have other forums that we speak to service users, and we can just ensure that this line of inquiry continues to be part of those agendas rather than, as you say, a one-off survey. So again, where there's the carers group, and particularly individual units tend to have service user forums where it's both, if you take the intersupported living unit, then the residents and their relatives would be part of a user group which then feed back to the carer. So we can always join those agenda items and get regular feedback on technology.
We can pick that up as well. I beg your pardon, councillors. Councillor Haggard, have you indicated? So Councillor Cooper and Councillor Cooper first, and then I'll come to you, Councillor Sweeting.
Thank you very much. Yes, I think that's pretty comprehensive, and probably I'm going to suggest things that you already have in mind, but just to be absolutely clear, I do think we need to clearly identify how we're going to overcome barriers to the take-up of technology, because we've heard over and over again. I mean, one group we were with, I think it was 30% of them said they don't have access to the internet. So there are a huge number of barriers, and it's not just those, it's the physical ones. It's the people with arthritis of the hand. All of those things. It's all in there. I just think it needs to be pulled together so that when we're looking at what we're doing, we understand why we're doing it and how we're going to overcome those challenges. The other thing, to go right to the other end of the strategy, is I think it would be helpful if you could draw the threads together at the end, and perhaps something like an action plan. I hesitate to use that word, it's probably very old hat these days, but that's what I would have done when I was at work. So an action plan that shows us what success looks like, so we've got targeted outcomes and a timeline. That would be really helpful, I think.
And I think that point can usefully feed into the wider piece of work anyway, because I mean, that's going to have to happen anyway, Darren, isn't it? So I think as part of the general rollout of this, so yeah. Yeah, target outcomes. Yeah. Particularly matching alongside resource availability to ensure that there is diversity so that we can get the best outcomes for that money. Sure, thank you. Councillor Sweeting.
Thank you, Chair. I think the report that we received yesterday and the next steps that you list are very good as well, because several of those do dovetail into the areas that the Chair has indicated. I do think there will be the issue of any fees that might be attached to any, equipment, because it came loud and clear from the report that a lot of responses that they were not prepared or not able to pay more. And so this is, we would like to do X and Y, but we all know that budget is going to be a difficulty. But I must admit, when I read page 6 and your strategy, I thought that many of those we could dovetail into our recommendations. As I say, there's quite a few that I've ticked off that seem to dovetail already in what the Chair has said.
And I think we can usually pick that up in the work that's going to take place, Darren, in bringing this forward, really. As you say, there are synergies, there are parallels, certainly. They're not identical, but there are links, certainly. Anyone else indicating? No one else is. Okay, right. Well, can I take it then that we're agreed on what I'm suggesting as broad themes we worked up with the additions that we've had from colleagues around the table? I trust you've captured those, Anisha. So if that's okay. With that, can we agree the recommendations? Lovely. Thank you very much indeed. And thank you, Darren. Thank you very much indeed for your input, and we'll look forward to again in January with some recommendations to consider.
Thank you.
Thank you very much. Thank you. And happy Christmas indeed. Thank you. Right, so on to the agenda item 9, the work programme. All I have to say about this is just to remind colleagues that I did talk about an update on public health at our when we were looking at that item. So we're looking at spring. March or April has been suggested, so I think we can worry about the date when we've got a bit more meat on the bone. But I would like to record that we'd want that addition, please. That's what I've got to add, and I think Councillor McCrana's got a comment as well.
Yeah, thank you, Chairman. So the next corporate parenting panel meeting is actually on the 25th of January. So I see that it's down here we're supposed to receive the minutes on the 5th of Jan, so I think that date needs to be changed. Yeah, thank you.
Okay. Councillor Hagger.
Yes, thank you, Chair. I think it would be really advantageous if we had some information and some updates on COVID. It's been a while, and with the new variant coming in as well, how that's going to affect us, etc., etc. And I'm just conscious that we haven't had that here, and I think it'd be really good for residents to see and know on how we're tackling that and going ahead.
And we can certainly ask for that, absolutely. I mean, whether it's a report to committee or just general information, and of course it's within our gift to ask for these things, and can we note that, please, Nisha? I mean, I think that's a fair one. Do you go along with that, Councillor Prince? Okay, fine. Any other comments on the work programme at all? No? Okay, is that agreed then? Thank you very much. And finally, we come to the forward plan. Unless anyone's got anything to say about that, I will just comment that there's a new sheet here that's gone to all the select committees, written by Mark Braddock, around the requesting of information and protocols around that, which is useful to have. But other than that, I've nothing further to add, unless anyone else has. Is the recommendation agreed? Thank you very much indeed. Thanks everyone for your participation. Another good meeting, I thought. So thank you. Thank you.